There's so many wonderful things about living in Denver, and we pride ourselves on all the unique offerings of our city. In particular, we're mile high. We're 50 to 80 feet above sea level. But when you start to think about what this means for a risk of skin cancer, it starts to become significant. So, can you comment about what we need to know as Coloradans, living at high altitude, and what that means for our risk of skin cancer as compared to somebody at sea level?
So, yes, we are so fortunate to live in our beautiful state of Colorado, but it does come with some downsides in terms of skin cancer risk. So, Colorado does have one of the highest risk of skin cancer in the country, and that's linked to a couple factors. One is the altitude. So, we get more ultraviolet radiation exposure because of our altitude. Our beautiful climate also contributes. Having so many days of sun a year increases our exposure. And then, I think we also pay the price for being the most active state in the country. With all of our outdoor activities, we also get a lot of sun from that. So multiple factors contribute, but just important to know that Coloradoans definitely have some of the highest rates of skin cancer in the country.
There's often this misconception that during the winter months, we don't need to worry as much about sun protection because we're wearing long sleeves and we may not be spending as much time outdoors. So, what advice would you have for us as we head into the winter and how we can minimize our risk of skin cancer?
Definitely important to remain vigilant during the winter months. I mean, the shorter days, the sun isn't as strong. It can be easy to not be as concerned, but ultraviolet radiation is still a big concern in the winter. So, continuing to protect yourself, sunscreen on exposed areas. I think we're going to have some unique issues this winter because most of us are going to be wearing masks when we're outside. So, it will be more protective in some ways because our central face will be covered, but at the same time, the mask is going to rub off your sunscreen. So we just want to be really conscious of reapplying multiple times because I think the friction of the mask is going to take our sunscreen off. And then another factor in the winter for Coloradoans is just because we do so many winter sports, be it downhill skiing, snowshoeing, hiking, those are all going to be increasing your risk of sun exposure. Sun coming off the snow is going to affect some parts of our body that we won't normally think of, under our chin, our ears. But they've really shown, and we're doing most of these sports at very high altitudes. Our ski resorts are so high. So just really important to even though you're cold in the winter, that there's still a risk there.
So, you talked a little bit about UV radiation, Dr. Brown, but what are some of the other risk factors for skin cancer that we ought to know about?
So when we think about skin cancer risk, there's intrinsic factors and extrinsic factors. So intrinsic factors, the number one is going to be your degree of pigmentation. So the more fair you are, the greater your risk of skin cancer. But it is important to know that people with darker skin types can still get skin cancer and need to really have an awareness of that. For skin cancers, there's often some component of a genetic factor. So a family history of melanoma is also a increased risk of skin cancer. And then extrinsic factors, exposure to the sun, of course, and protecting yourself from the sun, but then artificial UV radiation. So tanning beds in particular have really been shown to increase our risk of skin cancers.
You did mention a little bit about the risk factors, but I want to ask you, Dr. Brown, what about screening? Who should get screened, and what do the guidelines say about how skin cancer is detected and screened for?
So the screening guidelines are not fully as established as they are for some other types of cancer like colon cancer or breast cancer. That being said, usually when I talk to my patients, I think that everyone should have an initial screening exam by a board certified dermatologist in their 30s. And the advantage of that is that they can then take a look at your family history, your previous sun exposure, any areas of concern, and sort of come up with a game plan of how often you need to be screened. Should it be once a year, every 5 years? I do have a subset of patients, so patients in their 20s that have very high risk factors. So that would be very fair skin, history of extreme sun exposure or tanning bed use. Um, People with more than 40 moles have been shown to have an increased risk of skin cancer. So that's another factor. And then our patients that are immunosuppressed. So our immune system is very important in preventing skin cancer. It's kind of constantly patrolling our skin and helping us stop from developing skin cancer. So patients who are immunosuppressed, be it from medications they need to take or from underlying conditions, are going to be at higher risk of skin cancer.
You mentioned moles. A lot of us have moles. How would I know whether a mole is cancerous or precancerous or needs to be checked out?
Yes, I mean, the majority of us do have one or more moles, and they can be ranging from pink to brown to a darker color. They can be raised or flat. But it's important to know that, what we think about with moles when we're concerned is the development of melanoma. So melanoma is a type of skin cancer from the pigment cells in the skin, and it's one of the most dangerous cancers exists. So early detection of melanoma, though, has been linked with much better outcomes. So the sooner you detect it, the better. So we really want to know what to look for when we're thinking of is something melanoma. And melanoma can arise from a pre-existing mole that you already had, or it can arise on its own. And so when we're thinking about melanoma, we talk about the ABCDEs of melanoma. And these are just a set of factors that we think of when we're looking at a mole on someone's skin, or you're looking at your own moles. And it's important to know that screening by physicians is very important, but that many people detect their own moles, own melanoma, their own skin cancer, or their spouses. So screening your own skin and looking for changes is really important. So for the ABCDEs, A is for asymmetry. So if you drew a line down the middle of the mole, would both sides be a mirror image of each other? B is for border. So we want to have a regular smooth border, so round or oval, no jagged edges or anything like that. And C is for color. So one of the signs of melanoma is a darker color, like a brown black color, a black blue color. But melanomas can rarely be pink or show white, like an absence of pigment. So in terms of multiple colors is concerning, and then also changing colors. So a mole that's changing in colors, even if it's not necessarily getting significantly darker, it is something to be concerned about. And then for D, we have diameter. So most melanomas are greater than 6 millimeters in diameter, which is about the width of a pencil eraser. So a mole that is a little larger, is larger than that, or is increasing in size is concerning. Although a caveat being there are melanomas that are smaller than 6 millimeters. And then the E, probably the most important factor, is evolution. So once we've reached around our 20s, our moles should be pretty much set for life. There's a few factors that can cause them to change, but in general, they should stay the same. So if you have a mole that's changing, getting larger, the color changing, the border changing, that's a really key sign to getting that mole evaluated.
So, a lot of people know about melanoma, that it's a skin cancer, but there are many other types of skin cancers that also exist. So, what do we need to know about those types of cancers and how they're detected and what the risk factors are?
So the most common types of non-melanoma skin cancer are going to be basal cell carcinoma and squamous cell carcinoma, and these are some of the most common skin cancers in the world. They're lower risk than melanoma, but they still can be concerning and need to be treated. So the things that we look for those types of cancers, frequently we'll see a skin color to pink to brown skin lesion. Oftentimes it can have some crusting, bleeding, pain or irritation. And oftentimes our patients tell us, they have a spot that just won't heal. So it's persistent, it's slowly increasing in size. And those are things that are indications to see a dermatologist, to have it evaluated. And a lot of times we can look at these spots and kind of know right away, is it something completely safe and benign, or is it something more concerning for skin cancer? And something that we are worried about skin cancer, we'll frequently do a skin biopsy, take a very small piece of the skin lesion, and that tells us, what are we seeing by looking under the microscope. And then what I specialize in is surgery for skin cancer, a procedure called Mohs surgery. So there's lots of ways to treat skin cancer, and in general, the outcomes are wonderful. So caught early, skin cancer is very treatable, and very manageable.
And people say our skin is our biggest organ, so we do have to take care of it. We often forget that.
Yes, I mean, we worry, of course, about skin cancer risk, but it's also important to know that the sun is one of the key factors in aging. So the sun damages, the collagen and elastic fibers in our skin. So part of minimizing wrinkles and things like that is to stay out of the sun.
What type of sunscreen would you recommend? Are they all the same, or what do I need to know about sunscreen that I should use?
I mean, I always say like the best sunscreen is the one that you're going to use consistently. The important things to think about with sunscreen are broad spectrum. So you want protection from both UVA and UVB radiation. You also want to make sure that you're having a high SPF sunscreen. So the way sunscreens are tested, you're applying a significant amount. And so most of us don't apply that much sunscreen. And so they have shown that you're going to get more effect from a higher SPF sunscreen. So I usually tell my patients 70 or higher, just because the way, I mean, even me, when I'm putting on sunscreen, a lot of times I'm just not getting enough on. You got to put a lot on. So I think in terms of the type of sunscreen, I don't worry about that as much. I think it's really more important what you like best, be it a stick or a spray. There's physical blockers versus chemical blockers, and all sunscreens are efficacious. I would say in general, reapplication is key, applying enough sunscreen is key. And then also to think of sun protection as sort of a comprehensive plan. Sunscreen's one point, but the other sort of parts of the plan would be avoiding the sun when it's at its peak intensity between 10 a.m. and 2 p.m. and wearing sun protective clothing. So long sleeves, long pants, like a big hat with a brim, no baseball caps because they leave your ears and your neck out. So, really just taking a comprehensive approach to protecting yourself and protecting your kids from the sun.
Thank you so much, Dr. Brown. I'm going to pull out my big floppy hat, I think, this winter. But thank you for joining us and for all your insights and education and lots of important takeaways from our discussion today.
Oh, well, thank you. So it's a pleasure to be here. And, we just want to keep all of our Coloradoans safe from the sun in all seasons, including the winter.